Welcome to the center. My name is Dr. Babak Azizzadeh. I'm a facial plastic surgeon that specializes in facelifts, facial reanimation, and rhinoplasty, located in Beverly Hills, California. Here, we talk about all things facial plastic surgery. Welcome to the channel. Hi guys, this is Dr. Azizzadeh. Welcome back to my YouTube channel. So is it safe to do some cosmetic procedures at home? There's so many TikTok viral videos and Instagram videos that are promoting either treatments, devices, procedures that you can do it yourself at home. All right, so watch to the end so you could see all the videos we're gonna go over and see what's worth trying, not worth trying, what's dangerous, not dangerous. And please, if you are not a subscriber, subscribe and leave messages. We'd love to hear your comments, and also we'll respond to your comments so that you can have that info. So this pen is supposedly going to increase the lip volume, and most likely this is a compound that dilates the vessels of the lip temporarily, giving it poutiness. I would say for this, most likely, my guess is if it works, which I'm not sure it will, it'll work for a few minutes and go away. Is it dangerous? I think repeated use, it could potentially be dangerous. So I'm going to give it a no. So instead of this method, I would say a more long-term approach would be utilizing very, very conservative amount of fillers. Too much fillers in the lip can cause really a major deformity, almost, the duck lip and so forth. But a very small amount of hyaluronic acid filler that's done by a board-certified physician like a dermatologist, PA, and plastic surgeons, I think can be a much better and longer term solution so that your lips remain really voluptuous and pronounced and beautiful without needing to do anything at home that's very, very short lasting and really doesn't work. So gua sha is traditionally been used to relieve muscle tension and perhaps for some lymphatic drainage. And in this video, they're trying to see if it improves the jawline, and many people are using it for that. So lymphatic drainage is very important for our bodies. You know, muscle tension is very important. And if something relaxes the muscle tension, could it potentially have some benefit? It's possible. I'd really like to do more studies with this. I think the danger level is very low. The possibility of it improving, probably minimal, but sometimes we do things that make us feel good, and if it has very little risk, it's worth trying. But I would actually like to do a study looking at whether this works versus another method. Ice rollers are used because they can potentially reduce circulation in certain area because it shrinks blood supply. And that in some areas under the eye can potentially improve the inflammation under the eye. So you got to be careful. The only danger zone is you could potentially burn your skin and irritate the skin, because the eyelid skin is the thinnest and most sensitive skin we have. So as long as you're careful with that, probably the risk danger issue is low. And if it helps you and makes you feel better, I'm okay with it. So what alternative methods are there? If you have puffiness and fluid accumulation, and really under the eye it's usually fat pads that are bulging, the best method is utilizing surgery, which are incisionless, where those fat pockets can be removed very easily by board certified oculoplastic surgeon, plastic surgeon, or facial plastic surgeon. Sometimes you have hollows here, you can use fillers or fat grafting. And for tighter, very jawline that's like really, really attractive, ultimately there's really two options. Energy-based devices for younger patients that tighten the skin, or deep neck or neck contouring for individuals who have more fat accumulation, smaller chins, more puffiness here. So in some younger patients, surgery is actually the best method to address that. So there are a lot of different methods, but the bottom line is you have to see an expert to determine what's best for you. This device, we're going to call it a device, home device, is basically, it looks like it's just a high vibrating stimulator. I'm not quite sure what it's doing, to be honest with you. There are no clinical evidence, even a before and after, to show something. So I would say probably a gimmick and unlikely to work. The danger part of it, I don't know, but I wouldn't try it myself. So I'm going to say no. Much better way of approaching this is, number one, going to your skincare specialist and getting a facial. So that works really well, especially cleaning up the skin. Then the second thing is going to your plastic surgeon, dermatologist, and so forth, maybe utilizing something called hydrofacial, which is a really nice product and device that cleans out the skin professionally and with a great outcomes. And then getting on great skincare regimen, avoiding the sun, and just taking care of your skin health instead of trying gimmick products that may not work. So that's kind of what I would do. This is interesting because silicone gel sheets are phenomenal products for scar management. Post-surgery, even when there's a natural scar, it tends to flatten them, make them look really good with long-term use. Now, when they say clinically proven, this product is not clinically proven for forehead wrinkles or crow's feet and so forth. It's proven for scars and scar gel management. So I love the product, and for its use here, could it work? I don't think so. I think most likely what it's doing, it's causing a little bit of inflammation, and when you pull it off, it's causing a little bit of swelling in that area, and as a result, that area looks a little bit better. But I'd like to actually see if this can be tested for this. I'm open to that, but I wouldn't buy this for forehead wrinkles or crow's feet at this point. So another method that really works and has been really clinically proven is utilizing Botox or a newer compound called Daxi that lasts a long time. These products are really effective. They relax muscles and get rid of my forehead lines and crow's feet. So I would use those products, and when they're done by really trained practitioners, they're wonderful. Microneedling is a superb treatment for skincare management and improving skin, minimally invasive, but it needs to be done at a doctor's office, because how you do it, the way you do it, what product or compound you use, we often use platelet-rich plasma, PRP, or really well-studied exosomes, really fabulous. At home, at least the way that I saw it here, it can potentially, I think, irritate and damage the skin because the needles actually kind of penetrate the skin. So I'm not quite sure if both the way that this product is done or device is used at home or the utilization of it at home is great. So I'm going to give it a pass, no. A much better alternative is go see your physician who's an expert so that you could come up with a plan. Microneedling is one part of that plan, and that should be done by a really great practitioner that knows what to use, what product to use, and I think you'll get a much safer and better outcome. Okay, so this video, not gonna work, okay? You cannot lift tissues by tape and have it be permanent. Now, I know I have some patients who come and until they get their facelift, sometimes they do a little taping back here that lifts it when they go out, but it's not permanent. For that time process, it may stick. but it could also irritate the skin. If you go over your hair, it could pull the hair out and wax the hair. So I would say definite no. Danger zone low, but definite no. So another method, if you want to get rid of wrinkles here, Botox. Easy, simple, works, effective, has been done for a long time. If you want to get your brows elevated, either an endoscopic brow lift, or you can do what we call a chemical brow lift using Botox. And if you want to get these lines fixed, fillers work really, really well, judiciously. And if it's your neck or lower face, if you're older, or you really have a lot of loose skin or tissues, or you were born with excess tissues, then surgery, facelifts, deep plane facelifts, deep neck contouring, they work really, really well. Now, not everyone wants to have surgery, but sometimes these non-surgical, do-it-yourself at home things can, kind of like not work. So save your time. I love social media. I love TikTok, Instagram. It's phenomenal. There's a lot of information out there, and there's a lot of sales out there. People are trying to sell stuff. And what sells the best? Minimally invasive products. Do it yourself at home. When, Botox and fillers and surgery can cost sometimes thousands of dollars, $40 for a device, something you could do out at your home, most people will be willing to pay for that. But with that comes a lot of gimmicks. So what you need to do is really think about seeing a professional, an expert, board certified plastic surgeon, board certified facial plastic surgeon, dermatologist, oculoplastic surgeon. Get information on what your goals are, whether it's minimally invasive or you want something more, and then utilize that to make sure that you're not getting kind of taken advantage of. Now, some stuff on the market are really, really good. Some skincare products, some devices are phenomenal. So, but you got to do your homework to make sure that you're not going to have anything harm you, and more importantly, you get what you're looking for. Now, I do want you to comment if you've tried any of these TikTok viral, devices at home. Let us know how it worked out. Love to hear your response, and please like, comment, and subscribe to our channel.